Well, I guess that's over to me. First of all, welcome everybody on behalf of Seniors for Social Action Ontario. This is a wonderful opportunity to have a bit of a conversation, ask questions, hear about John's new book, and to just get a sense of John's thesis about elder care transformation tonight. So, John, welcome to the session. It's great to see you again. You and I go back a long way, some 45
Certainly.
years I was thinking of today.
Yeah, I think so.
So it's
Great to see you, Doug. Thanks for the invite.
yeah, it's a long time. So, John, I wanted to start it off, just ask a few questions of yourself. You're pretty well known in the community living, independent living circles for many, many years, and you've got many publications out there in that vein, pathways to inclusion, changing the way we view disability, facilitating in everyday life. And then you did a book on shifting the paradigm in community mental health. But now you're stepping up into elder care. It's a different field in some ways, not totally dissimilar to some of the things you've been talking about in
Mhm.
disability field. But I'm wondering, since you've now have a book published in this area, just speaking personally, maybe I wanted to ask you about what sort of brought you into elder care now that you're doing some research and writing about this field.
Well, it's an interesting question, Doug. It's true. I have a long history of being involved with the disability issues. And in the 1980s, I started a research center. And the Center for Community-Based Research actually recently celebrated 40 years, still going strong. But our center was devoted to kind of how do we understand and improve human services for people who are maybe disempowered or maybe marginalized. And my focus was always on disability, even though the center had a broader approach. Um, I think the shift to understanding and looking at aging, Doug, really started as I got older myself. That's always a prime thing for people. I started reading a little bit more about aging. And then for the last, over a decade now, I've been a caregiver to my partner who has a pretty significant neurological disability because we know that disabilities increase with aging too. So that's another thing that brings my interests together. Um, so being a caregiver, but it was really the spring of 2020 which accelerated my interest in aging because I think you all will remember that the spring of 2020 was not a nice time in Canada for older people. We had almost 15,000 people in Canada, die during the pandemic, people who lived in long-term care institutions. So uh, I came together with Doug and Trish and Harry and a few other people to form Senior for Social Action. And that was really the impetus, Doug, for me to go deeper into the field of aging. And so I started writing some op-eds and then I realized, a couple of years later that there was more than just some op-eds here. There was some detailed thinking that I was doing in concert with you and others that I thought a book might be helpful to kind of increase the momentum for this whole change we want.
Yeah, yeah. I think personal involvement has always been something that's characterized your commitment to the kind of changes you've been talking about.
Yeah,
It's not hypothetical. It's not it's real
yeah, for
in terms
sure.
of your life. Yeah, yeah. So, John, I guess I just wanted to ask you to expound a little bit on about what you're saying. I mean, you're calling for a sort of a transformational change in elder care. So maybe you could expand on that and tell us a little bit about what you mean when you say transformational change. What are sort of the elements of that you're pointing to?
Sure. Well, I think if you think of transformation in any part of your life, a transformation is really about changing the hearts and minds and the priorities of people and systems. And I think as we think about aging and elder care, there's a lot of different things we could think about that come together. So I've got one slide here, Doug, that might be useful time to put this up. And those who are reading the book will have seen the 7 pillars for change, which really run through lots of different essays in the book. But the 7 pillars, I think, kind of all combine to form a bit of an image or sort of a value-based approach to what the future might look like. So we know that ageism is still alive and well, not only in long-term care, but in lots of elements. Research shows that, for example, in healthcare, people who are older don't get as much attention as younger people. So we need, I think, public education of anti-aging. What would that look like? How do we begin to educate people as we're getting an aging society? What would it look like for people to be educated about ageism? I think that could be a really important pillar. I think we also need to promote healthy aging. And in some of my essays, I go into a lot of depth about some of the research on this, but it's very interesting now. What the research is showing on healthy aging is we want to try to have our health span be similar to our lifespan. In other words, can you stay healthy for as much as your life as possible? And it's very interesting to know that if we work on things like exercise, nutrition, having a good attitude, having a positive attitude about aging, having strong relationships, that those things really make a difference in terms of expanding our health span. So I think this is a really important thing that we need to pay attention to. I put long-term insurance here because I want to make people aware that in Canada, the Healthcare Act that guides healthcare in Canada didn't include long-term care or community and home care. So because it doesn't include, governments are always cautious to spend money in this area. So what some countries have done have put in a long-term care insurance plan, which is sort of like employment insurance. You spend a few dollars a month, your employer spends a few dollars a month. And in Japan, for example, when you get to the point where you may need support, you get to choose where that money is used. Is it for home care? Is it for making your house more accessible? How do you want to use that money? So I think we need some way to figure out expenditures in this field, and that would certainly be one way. Number 4 is obviously something that a lot of you care about. How do we develop a community-based nonprofit care system? The last few years, we've seen a drift in elder care towards more privatization, and some of us are very concerned about that because as we found during the pandemic, and Doug, you were front and center to that work, the system is very unbalanced, right? The current system favors. In fact, in Canada, we spend about 80% of our elder care dollars for long-term care institutions. Countries like Germany and Denmark, Japan, the ratios are very, very different in favor of community-based care. We also need to figure out how to support informal caregivers. Statistics Canada recently reported that several thousand, I'm sorry I forget the exact number, but it was several thousand Canadians every year are leaving employment in order to care for a spouse or a mother or a father, somebody in their family that needs support. So think about the impact that has on our economics. And why wouldn't we have a plan that allows those people to support their loved one, but also have some remuneration for that work? That would be huge for a lot of the baby boomer generation. And in fact, we already have a program in Canada, in Newfoundland and Labrador, that does exactly that. So that could be replicated for the whole country at some point. I'm a great believer in well-developed natural supports. And you can think of natural supports as those things that we can do ourselves, not necessarily, probably without government funding or government intervention. And there's lots of those things going on now in Canada, whether it's support circles, whether it's naturally occurring retirement communities. There's lots of things going on now which are really in the realm of well-developed natural supports. And if we develop those, we're going to be healthier. because people who are lonely, people who are isolated, don't live as long. They have many, many more health problems than people who have a robust set of relationships in their life. So I think that this well-developed natural supports is a key part of transformation. And the final thing I would add is age-friendly communities, which, if those of you who don't know, there are in fact dozens and dozens of age-friendly committees across Canada. And the community I live in, Waterloo, Ontario, had the first age-friendly community in Canada, going back about, must be 15 years now. And the mayor was so taken with this idea that she appointed a mayor's task force on age-friendly. And they've been very influential in influencing transportation decisions, decisions that the community is making about parks and recreation, decisions that the city is making about park benches in the downtown area. So age-friendly, if we could have age-friendly communities, think about the circle, how that would reduce ageism. Like all of these things, these 7 pillars, I would say, are all connected. So this was kind of my thesis, Doug, as I started the book, and then several of the essays talk about different aspects of this.
So that's kind of a summary, John, I guess you would say, of what you're describing as transformative change, kind of the what of things.
Yeah.
But I think for many of us, there's also sort of levels of change. Like where does this, how do you come at this? If that's the content, how do we come at this? What are the areas of change that you're kind of promoting for this transformation?
Yeah, well, I like the word levels, Doug, because I think really there are 3 levels that I talk about. And those of you who have gotten into the book, you'll know that on several essays, at the end of the essays, I talk about things you can do, as an individual, as a community, and as a system, or as government. So just maybe to talk about each one briefly, I think the individual level often gets underestimated when we think about social change. But what we do as individuals has a huge ripple effect, right? If I have a positive attitude about aging, and I have my grandchildren and my children and other people, that's going to rub off on them, right? So our attitude that we bring to this work is very important. And the other thing I think at the individual level is we want awareness and action. So it's not just to be aware of the issues, but what kind of action can I take? And we should never underestimate the power of consumer demand. And just an example that I actually found out about a couple of days ago. Some of you will know in Ontario, there is a direct funding program called Family Managed Care. And up until recently, you had to apply to the province. So you had to go through Queen's Park and all kinds of levels of government to actually receive, if you were lucky enough to receive family managed care. They haven't made an announcement. What they're quietly doing is because there's been so much consumer demand for direct funding, the province is now hiring a family managed care coordinator in every region of the province. So think about that. It's a small change, but it could have huge ripple effects if more and more people locally are actually being able to access direct funding. And for those of you who don't know, direct funding simply means instead of having your home care workers come from an agency, usually a private agency in Ontario, you hire your own workers, you receive the money, and then you hire workers that you want, possibly people from your network or people you've known for a long time. And that's what we've done. We've hired people that my partner knows really well, and she's very happy with that. So lots of things at the individual level, Doug, that we could talk about some more, but because of the importance of that, I actually put an essay in the book on things we can do to build our own resilience and capacity as individuals. I hope that's helpful. So the second level of change I see is really the community level. And sometimes we might refer to that as the cultural level, because we know that cultural change always precedes, political or system change, right? What people do in the community and the attitudes they have, the advocacy they bring forth will have an impact on the system level. So really in Ontario and in several parts of British Columbia and other parts of Canada, we're seeing really tremendous growth in community change. We're seeing naturally occurring retirement communities popping up all over the place, where maybe a building that has 60% seniors, people are getting together to support each other, have meals together, do fitness classes together, all kinds of possibilities there. We're also seeing age-friendly community committees being very active across the country. So those would be examples of community change. And we need also service innovations and good service practices at the community level to demonstrate to the system what's possible. So I think of things in Ontario like the hub and spoke model or memory homes or things like that, which are demonstrating at the service level really high quality work. And then, of course, the third level of change is the government and the system. And we know that changing systems is not easy because it involves both policy change and shifting priorities. And I think we often think of big policies, but the small policies in the book, I describe some small policies which can make a huge difference, right? Just imagine if you made, which I already described, you make direct funding more more easily for people to access. That's a small change. The bigger changes of reallocating funding and resetting priorities obviously is a bigger task. But I think, Doug, I think you and I have worked together a lot, and I think we realize that those three levels often work together, don't they?
Mhm. Mhm. Yeah, yeah. Yeah, I think those are really intertwined, John, but it's good to sort of point them out in terms of there are because it speaks to the responsibility that we can all sort of step forward to, depending what our role is, whether it's in government, in neighborhoods, and within families. I think it speaks to something that we can all kind of do. It's a huge issue. It's at our doorstep right now, elder care and what's going on. We're spending billions and billions of dollars more on the institutionalization of elders instead of the development of that community-based elder care system that you're talking about. So it is a really big challenge right now with vested interests too kind of standing in the way. Um, I want to say to the audience that we want to open this up for questions that you might have to and for John. It doesn't matter if you've read John's book or not, but we're talking about elder care in the broadest form, and John has a thesis that he's putting forward. So if you do have some questions, it's a good time. Just raise your hand as Harry mentioned, and we'll get to your question, or you can put it in the chat group. But it's good if you want to raise your hand to talk about this a little bit more. And then I'll just call on you as we go along. So don't be shy about that. I did want to just give a little plug for the book, if you don't mind, John. I would do that. If you can get the book, I'm sure, in many different places, but you can also get it at johnlord.net. So I'll say that right now. You can go to johnlord.net and you can get a copy of the book there. But if there's any hand, you can press the button, or Jerry, are you raising your hand? Your physical hand, are you? Well, why don't you can unmute yourself and you can ask a question to John if you want.
I'm interested in John's comments regarding NORCs. I live in a condo building, so obviously the majority of us in this building are owners. And there's certainly amongst some of the people in the building, there's been quite a bit of discussion and work done around NORCs. But I think I'd like to ask John, where does he see the success stories in actual condo buildings? My knowledge, which isn't vast, the success stories are more in rental buildings where you don't have a board, where you don't have owners who may not be happy about a NORC sort of turning the building into an old folks home, as some may view it, and see the value of their individual condos potentially go down. So I'm not sure I understand where the success rate is in condos versus rental buildings.
Well, thank you for your question. I actually haven't seen any research on Norks in condos, but I will share a personal story. We used to live in a condo. Twice, actually, we've lived in condos. And I would tell you that both times there was a lot of politics. And that's because the board didn't always have full agreement from everybody who lived in the condo. And I'm not saying that condos always have politics, and maybe a lot of the condos run smoothly and are very open-hearted, because you have to be open-hearted in this work of engaging each other in change. And so that was our experience. We've moved into a rental apartment that has 44 units. And one of the things I love about 44 units, it's to scale. It's not a high rise with 1,000 units. It's 44 units. So we probably know half the people in the building by name. And we have started a naturally occurring retirement community, but we don't call it that. The name of our building is called the Cortez Building. We call it the Cortez Supportive Community. And we haven't limited it to older people, which I think the research will show eventually, and it isn't showing this yet. But my hunch would be if you have a NORC which has a little more inter-age activity, and we have people from 45 to 90 in our group, probably 16, 17 people that meet every 6 or 8 weeks. We don't have the facilities to meet weekly like some of them do. But there's a lot to learn from the condos, especially those that started in Kingston.
Yeah.
I have quite an extensive discussion of those in my book as well.
Well, we have 228 units in my building, and I have to say, in favor of my building, we have a lot of social activity which we have already set up. But it would be interesting to see how owners would receive things like services coming into the building. And I think, while some people would be receptive, I get the feeling a number of people would not be, because they would perceive some of us trying to turn the place into an old folks home, and they would be concerned about the value of their property. I do think it's easier to get a NORC off the ground in a rental unit, in a rental building. So I'm always interested in how successful NORCs are becoming within the condo environment. But thanks for your comments, John.
Well, let me just say one more thing quickly. I think there's a danger whenever we have a new concept, that then it becomes the thing that we all have to do.
Yeah.
And we don't want this thing called NORCs to become cookie cutter, right? So I think if you're interested in how people can support each other in your building, start with 1 or 2 people coming over to your place for tea and having a conversation and thinking about what would be possible. Maybe watching a video of a NORC or something, and just try to build it piece by piece, slowly and carefully, so that it fits your building.
Yeah.
Yeah, I think that's a really good idea, John. I just wanted to add parenthetically about this NORC discussion before I get to Trish and Trish, that NORCs are typically thought of as in buildings, rental buildings or owner buildings. But if my information is correct, I know that there's a NORC. Maybe it's the first NORC. I'm not really sure about that, but there's now a NORC established in a neighborhood.
That's right.
So it's not building based, but in a neighborhood. I think Oakwood Vaughan in Toronto is a designated established NORC, which is a pretty cool thing to be talking about. That's what you mean, I think, John, about not having to be a cookie cutter approach to this idea of NORCs. Trish Spindell, can you go first, and then Trish Rawthorne after?
Yes, absolutely. And I just want to give another plug for another SSAO session that's coming up the end of October. Jerry Gribba, who lives in a condo building, 100 Madison in North York, will be talking about setting up a NORC there. So Your question is bang on.
That's right next to my building.
100
Good timing.
Madison. So there you go. So Jerry will be talking about that. I think it's October 22nd. At any rate, John, I'm very interested, of course, given my obnoxious personality, about what you had to say about cycle breakers in your book, and how cycle breakers are people who can start to, they just don't accept things the way they are. They're disruptors, I guess, in a way. And that's how change comes about. So I wondered if you could say a word or two about cycle breakers.
Yeah. Well, you're certainly one, Trish. And
Ah.
I think a lot of us who've been part of SSAO try to bring that spirit to what we do. And a cycle breaker, I think, is just somebody who doesn't accept the status quo and is willing to ask questions. And that's the individual level of change, right? We need lots of people who become aware of the issues, but then are willing to ask questions. And so the other thing I kind of weaved into some of the essays is this idea of curiosity. You know, be curious. Be curious about a NORC and find some ways that it can work for you and with the people you are at. And I've often found in my life that Margaret Mead, who I had a chance to work with or to get to know in 1968, was a very famous anthropologist, of course. And she said, small groups of people always make the change and always start the change. And she said, that's the only thing that has. So I always remember that. And for me, that's sometimes the way I break cycles or the way I change the way things are. I bring people together. And I say, could we do this differently? Is there another way? And the other thing that I'm probably known for in the training I do is teaching people to ask the who question. You know, sometimes when we have a problem, the first thing we do is say, well, what can we do? And we try to fix it. And quite often, to break the cycle or to break the way things are happening, you have to ask the who question. Well, who's really making things happen here? In other words, where's the power? Who could we invite to change it? Who else would be interested? And often when you ask the who question, you begin to bring people together in a bit of a disruptive way, but also a new way that can make a difference in your community, whether it's small things or big things.
Yes, so true, John. And you've had a long history of being a disruptor, much to your credit. Doug, I just wanted to point out that EJ in the chat has asked where the hand raising icon is. So I think she will want to be after Trish Rawstone.
Trish, why don't you go ahead and bring forth your comment or question to John?
Sure thing. Great, thanks very much. I'm enjoying the talk, and I do have your book here, so I shall get on reading that one in order of the ones that I have right now. I tried to start conversations on Birdsong neighborhood care, which is a disruptive form of home care because we have such dysfunctional home care, certainly in Manitoba, and I'm sure that's true of elsewhere. We can't afford the $309 an hour nurses from the for-profit agencies created by some nurses and some healthcare people, but usually they're run by large billion-dollar organizations. There's no oversight. They aren't regulated. We're going to have the same issues that Christine Kelly wrote about in home care, is that people who are not regulated and come into your home can basically do whatever they want. So I will try to make people to understand that when you hire these people, you need to know who is responsible should something happen. It's the same as insurance policy. BNC, I'm trying to get that in. I will now change my tactics and try and introduce 2 different competitors so that I can convince the government that my Birdsong neighborhood nonprofit care nurses that do health and social care will actually beat out the for-profit $309 nurses and the antiquated home care system we have now. The question about who is overseeing, churches now are now dwindling down in their number of people that are part of their congregation. And I just met with one that's going to be creating their own NORCs by renovating their churches. So there's a lot that's going on, and I would encourage people to get out, visit these places, find out, and encourage places like churches to take on the challenge of finding homes for seniors. I did find out from my housing counselor that the bylaw that states that you cannot have an unrelated person living in your accommodation, your house, is not a real bylaw. It's a bylaw to prevent more than 6 people living in a home. But now we're getting interest in the 61% of people who own their own homes in Winnipeg, live in them by themselves. And those are perfect community NORCs to get started, to home share with other people.
Thanks very much, Trish. I'm just looking at the chat. There's a question, John. Maybe you could just say very briefly. There's a question from someone asking about. Carol's asking, what is a NORC?
A NORC is a natural occurring retirement community, which is, and it describes a neighborhood or a building where more than 60% of the people are over 55. And a NORC itself is not an action, but a NORC is a sort of a demographic description. And what the NORC, and I see in the chat, there's been some discussion of the work in Kingston, which is very effective. And I think they have something like 12 NORCs they're supporting across the province. And the people who get together often decide that they want to support each other in interesting ways, right? Like in our building, for example, the 17 of us have each other's emails and phone numbers. Last summer when I got COVID, or during the pandemic, I had a very serious case of COVID. My neighbors were amazing, shopping for me and bringing me meals and helping out in all kinds of interesting ways. So that's one of the things that NORCs generally do is people supporting each other. Another thing they do is organize programs. So in buildings that have space, oftentimes people get together once a week for a program, or maybe 3 times a week for a fitness class. In some buildings that have really good facilities, you might even have people being able to share a meal together. That's usually the second goal. And often there's a third goal, which is about social connections, relationship building, and reducing loneliness. And some of the interviews I did for the book were interesting. I heard from people saying they felt so much better now that they connected with neighbors, that they felt less lonely than they had before. So I think those are generally the three parts of a NORC.
Yeah. I wonder if I could, anybody else, if you want to put your hand up, please go ahead and do so. But I noticed Helen Cooper's on this Zoom tonight, and Helen has written that there's Oasis is now in 19 communities. Helen, I was wondering if you wouldn't mind saying a few words about Oasis and its spread, because I think you're somebody who knows a fair bit about this. Would you mind saying a few words about this?
Yeah, I'm chair of the board of the original Oasis. I mistyped originally. They're not 19 cities. But they're 19 sites now. And most are in Ontario, but there are now 4 in Vancouver and 2 in Halifax, as well as 2 in Thunder Bay. I said a 3-building condo site in Ottawa, 4 in Kingston. I'm bound to leave somebody out. 1 in Belleville, which is a mobile home park, which is another variation on this theme. Somebody here has already talked about Oakwood Vaughan. We've got to know the folks there very well, and they're using a neighborhood model. So Sue Lance has written in on the chat as well. The Oasis does not presume to be too ambitious. Dr. Lord, it is exactly what you're talking about. It's concentrating on nutrition, exercise, but most of all, socialization. And the original Oasis is still going. It's in an apartment building in Kingston, a building that was built in the 1960s. And it's we've discovered, it's been going for, it was incorporated in 2011. It was started as a pilot project funded by New Horizons before that. So it's been around for quite a while. It's been profoundly successful. It's so successful that the average age of people in this apartment building is well into their 80s. And uh, so the challenges we face at this point is the dearth of rental accommodation. Unfortunately, greater economic events, post-COVID in particular, are affecting us. When an apartment is vacated now, the landlord, because I said the buildings were built in the 60s, the units in many cases have never been renovated. When are vacated now, they renovate, but they raise the rents by about 50%. So a lot of the people in Oasis in our original building would tell you they couldn't now afford to live in that. It's rent controlled, so they can afford the rent they're paying, but were they to pay the new rents, they could not afford to live there. So I think there are a huge number of issues related to the larger economy. I work very closely with two professors at Queen's, Catherine Donnelly and Vince DePaul, who put heart and soul into this. Catherine is a occupational therapist. Vince is a physical therapist. And they've just acquired another grant from a private foundation to keep their work going, and they're hoping to establish a national organization, a model like the United Way, for instance, just pulling something up where there'll be an overall definition of Oasis so that certain values are retained no matter where the program is, but that there will be a certain amount of individual autonomy at different sites that is responsive to the needs of the people in at that site. So I think I've talked long enough, and this is Dr. Lord's
Yeah. No,
evening,
it's good
so
to
I won't
understand.
take up any more of your time. Just to say, we just had a summit in Kingston with everybody coming together from all the sites, and everybody's wound up and raring to go further.
Yeah, great. Thank you very much for that, Helen. I think it's important for people to have a better understanding of this as well as Elizabeth. Did you have a comment or a question that you'd like to bring forward?
Yes, I'm happy that I found my hand. Trish helped me. Thank you very much. I didn't use Zoom quite a few months, but anyway, I'm on my new laptop. So I'm happy to meet all of you and would like to share with John that we took an action, and I started with small group, as you were saying, and I was gladly hearing this, in 2019. And as young seniors here based in York Center and Toronto, and we started a non-profit organization called York York Center Senior Steering Committee. And what I find out, we end up with the model of the village for us, which will be intergenerational. We imagined that, and we discussed for years with a group of people that the model of this village should be based, and actually this was my also personal dream, based on Hagevik village, which I actually had a chance to visit near Amsterdam, 9 kilometers from downtown Amsterdam. And so lucky me, I convinced people, and we talked, we did the work, we met all politicians, and we actually got approved by City of Council of Toronto twice in 2022 and 2024 in May, that something like Seniors Village should be built. And we have potential partners but we are still in limbo. And guess what? Where is the limbo? Really, it's hard to convince people to work, to take action, because I find that I'm myself an immigrant here, 35 years in Canada. So I know all Scandinavian models, which are very kind of like blessed by Canadians now. And I'm happy to live here and work here, and fantastic country is. But we are blocking ourselves, I find out, as Canadians, to try to develop what is really us, not Denmark, not Sweden, which is actually amazing examples I'm bringing here. But we have our own resources. And what I also find out that Canadians were very spoiled by decades, and they were pampered, if I may say that, I'm sorry, that somebody will bring something on a tray. Well, I was born in northwestern corner in Poland. We had a tragic history, as you know, and we always worked for ourselves if we would like to end up with something what we wish to have. So I find out that my group of wonderful, wonderful ladies and men are still waiting for the kind of like miracle happened. They have reasons to say that they are busy, because they are. They have reason to say that they have appointment. They are, like everybody else. But how to mobilize everybody to take real action? John, I'm counting on you, and I will be having, I think, a connection to you. So I will write an email, and tomorrow I'm meeting with the group of community members, and we'll say about you talking today, and maybe you will be invited to our town hall. So this is what I wanted to say. I'm looking for advice.
Thank you, Elizabeth. Well, I think any of us who've been involved in social movements over the years understand your dilemma, how to mobilize. I can think of different levels of mobilization, right? You're trying to mobilize individuals, but you're also trying to mobilize the knowledge that can sometimes help people take a step. Because people have to believe that what they're going to do might make a difference. So think of individual mobilization, knowledge mobilization, and then community mobilization, so that it sounds like you're already, which I really appreciate, you're already building partnerships.
Yes.
With the city, with key stakeholders in the city. So that's come back to my who question, right? Who do you connect with? Who do you invite? Who do you bring together? And mobilization takes a lot of conversations. I've been involved in projects where we start with 2 or 3 people and we have a conversation, and then we invite a couple more people and we have more conversations. So oftentimes it takes a long time. Just look at the 4 years. Seniors for Social Action. Look at the 4 years Seniors for Social Action. We started, Doug, with what, 5 or 6 of us? And we gradually grew.
12 of us,
and
John.
we had groups in lots of communities now that are plugging into what we're doing. And we have as many as 1,600 people who are receiving our emails almost every week. So it takes a while. It takes a long time. It requires leadership. It requires courage. And it requires patience.
Yes.
And I suppose that's the one thing I've learned as not only an organizer and a researcher, but now as a caregiver. Patience is key. And to have that open heart and to not close it just because there's trouble. There's always going to be trouble. There's always going to be trouble. As some of my Buddhist friends say, shit happens. And it always happens. So you want to be ready with an open heart, but to keep it open, know when to close it, but know when to open it, so that you can build that capacity with a few people.
Trish, I see you have your
Doug,
hand up.
Doug, this is your work.
Yes,
Doug, you're the master organizer. What do you think?
I'll let Trish talk first.
Good choice, Doug. Doug was one of the 12 who started SSAO. Actually, Elizabeth, I think some of the problem may be this. We at SSAO have gotten a lot of feedback from our members. They are not interested in seniors villages. They consider them stigmatizing and isolating, and they would rather be part of an integrated community. So that may be part of the problem that you're facing. What they really want is they want integrated supports and services close to where they live. And that's why the hub and spoke model and the PACE models and other types of services like that have been so popular, and why NORCs are so popular, because they're community based. They don't sort of take seniors from their normal neighborhoods and move them to somewhere else where they're going to be segregated. So that's the information that we're getting from a lot of our members. So I suspect that might be part of the issue.
I'm sorry to say that it's a contrary. Actually, community wants the village, and village was from the beginning intergenerational, never as ghetto-like. Simply, people would like to move across the street from their homes. I'm talking about Downsview, which has land and park. They wanted to be involved in design as not only participant as during the meetings, but we have everything prepared to our work. But I'm still talking about that they kind of waiting that somebody will come and do this. So physically, you need people involvement, like obsession, passion, as John said. And I've done this for 5 years, and few people have done this, and they are simply drained, right? They tired, and there is no new coming. So my question was how to activate and mobilize more, because this is proven that everybody wants that.
Yeah, the organizing
John,
question that everybody
sorry,
faces.
John, you do talk about process and not just outcomes, which I thought was important in your book also about that, about how not to get drained.
Yeah, I think that's very important. If you attach too much to outcomes, you can easily get disappointed because the outcomes might not come very quickly. And Doug, it occurred to me as we were talking and looking at some of the things in the chat that, one of the things that happened in the late 70s and the 1980s, when the disability movement was very concerned about institutions. By the early 1980s, there was actually a wide degree of consensus for that system change. Consensus among researchers, among individuals and families, amongst several civil servants, a couple of whom actually are on this call tonight. There was consensus that we needed to support people with disabilities to live in the community with dignity, with sense of community, with participation. And if we look at elder care now in Canada, there's no such consensus. So part of what I think people are feeling on this call is, oh my, it's hard. And it is hard because there's no consensus. There's great divide in terms of what is the best vision for the future for older people. And to try to move towards consensus is going to take a lot of time. And as that consensus begins to build, other people will come on board. I worked on several projects in my local community and across the country as a community-based researcher. And over again, we've seen that a few people start something and they do some research and connections. And as that energy begins to have good outcomes, other people come on board. So it's kind of like that ripple effect, right?
Yeah. Sue, you have your hand up there. Do you have a comment or a question you'd like to bring to the group or to John?
Yes, well, I'm just so delighted. This is such a wonderful milestone. Congratulations, John, on your book and all of the ideas.
Thanks,
I
Sue. Good to see you.
I was going to add, in addition to NORCs and home care and all of kind of the creative solutions we're talking about that are needed and valuable, an area that I feel we're really needing to make big progress on is housing and innovative housing, universally designed housing, smaller scale housing, inclusive housing. Because without this housing, you can't couple it with the right services and supports and social networks and so on. And so I feel like we've got, when you talk about diversity of solutions, diversity of culture, and finding consensus, I think we have to find ways to derive consensus on even the building blocks that allow for people to age and increase their lifespan and health span. And housing is one of the key ones, the right kind of housing. There are people that cannot come home from hospital because they don't live in the right housing. So just adding that to the mix.
Thanks, Sue. That's a really vital piece. And you know, we've watched the federal government spend a lot of money on housing over the last couple of years, but very little of it is targeted for the kind of thing you're talking about, right? Fully accessible housing. And I would encourage, one of the essays in my book, I talk about what we've learned from other countries. And it's interesting that Australia is by far the most advanced country in terms of universal design. And they've actually built it in to all housing. So all new housing must be guided by universal design, which is, you know, a much bigger standard than we have. And that's one piece, but the other thing is affordability.
Exactly.
Those are the two pieces which, you know, have to be addressed.
Stably priced, affordable.
Yeah.
John, I was wondering if you could, I'm just changing the topic maybe a little bit here, but we absolutely need all of these things that people are talking about here. We need the mobilization of people's energies. We need universal design in our housing. At some point, though, the system has to sort of take on board this feelings that people want to age differently than the options that they are being given with the public dollar. Before COVID, we had $4 billion serving 80,000 people in nursing homes, the way we had institutionalized people. At that same time, there was $1 billion pot serving 400,000 people living with home care support. So we can see this incredible imbalance in the investment of public dollars.
Yeah.
So now we fast forward and we go through 4 years of COVID, and we see this knee-jerk reaction, really, to increase the nursing home budget from 4 billion to 10 billion, adding 30,000 people to the list of the 80,000. And meanwhile, home care still gets the crumbs. The home care is given 500 million here, another 500 million, and now we're up to about 500,000 seniors. That's not all the people in home care, because some are younger, coming out of hospital, etc. But about 500,000 seniors now using like $1.5 billion. This is incredible imbalance in the investment. What are some of your thoughts on this? You know, this shift, if we're going to have a shift that needs to take place, the shift in investment when there's such heavy vested interests in the current way of spending money on elder care in our province.
Well, that's the crux of the system change problem, right? Not the community or the individual, but that's the system change problem. That's the crux of it. But the individual level and the community level need to be alive and well. And I think Trish hinted at some of that when she talked about the PACE model and hub and spoke model in Peel. And there's a couple of others in British Columbia that are really interesting, like service models on the ground that are working. And we need to find a way to accelerate those. So if you can imagine that we have on the ground some really effective innovative approaches. And if those can begin to be funded elsewhere, and that's beginning to happen in Ontario bit by bit, government is putting out feelers and beginning to fund gradually other PACE models. So we might begin to see those in 5 or 6 communities in the next year or two. That's very slow, but it's almost like slow change. It's like drip, drip change as opposed to transformative change all at once, right? It's going to be very slow. But I'm a believer in having good models in the community that the system can then see and promote. Okay, so the Ministry of Health or Ministry of Long-Term Care, I'm sure they already have people that are looking at these things and saying, oh, what would it be like if? What it would be like if we funded some small neighborhood care homes that housed 4 or 5 people, as opposed to having everybody in Waterloo go to a private care operator who had a horrendous experience during COVID. And so many of his people died. But instead, he's creating a village of hundreds of people living together and calling it a village. So it's finding the energy within civil servants and the politician here and there who's willing to be courageous and begin to shift the narrative. It's very hard though, Doug, I agree. I think there's more vested interest in this field than any other movement I've been part of. I've been part of mental health movement, I've been part of the disability movement, and the vested interests are much, much less. So this is a tough one.
Yeah, it really is, especially with the for-profit system involved in this kind of care. Jay, I can ask you, you have a question or a comment you'd like to bring forward tonight with John?
Comment. And, I've been out of the healthcare operation for the last 25 years, but I follow it slavishly on the media, through media and through LinkedIn and people like Ted Ball and people like Trish Spindle. And listening to tonight's discussion, I find it's a problem in a conservative setting, in a capitalist system, that doesn't want to look at the social aspect of us seniors. Because us seniors spent our lives building this country, building this land. I'm here 50 years, almost 50 years. And I've come away from South Africa. And I have family in Germany, and I visit my sister regularly. And she's living in a building owned, her, what you call living quarters is owned by herself in the building. And it's not called a condo, it's a seniors building. And the seniors buildings have got all the conveniences. And people come to them to take care of them, to look after the medication, even check up how they put the medication together. That is system that's come from the eastern part because she lived in East Berlin. So having said that, listening to the discussions here, although there might be people from the ministry listening in too, the problem I have, me who looked after healthcare for almost 18 years of my union life, find that for-profit has a lobby that what we call controls the agenda of whichever government comes in. The last speech I heard from Merit Stiles, it's the first time that I heard her talk about seniors. She says the government is not looking after our seniors. And I'm pursuing it, to go and ask the question, are you going to have a position on senior care, seniors living and seniors whatever? Now, having said all that, how do we as seniors mobilize? I know SSAO is growing, but we have to have a sort of like a movement going to change policy, push the buttons, go into when the time the election is called, to try to get to the front lines and say, if you remember what happened to Mulroney when the time he tried to tap into our CPP, what Grey Power did to him. So he just back off. So that's what we as seniors should try to mobilize. Living in quarters, I'm living in a home. I get somebody to come in and clean for me. That's all. I can cook and I can do the other things, and I'm manageable. And I get involved with Zoom calls like this almost every day in the week and cause trouble. I'm a shit disturber.
Oh, that's good.
You
But
would
Jay,
call.
let me respond to your comment, because you've made several comments. I think there's two that are really interesting. Like, one is paying attention to the election cycle.
Yeah.
It's very important. So paying attention to the election, and I'm glad you're reaching out to the NDP. We have people in SSAO who are also various political parties. That's very important. Making sure that our agenda becomes their agenda. But the other thing that's really interesting to think about is in comparison to other social movements over the last 40 or 50 years, the seniors movement in Canada is in its early stages. So what does that mean in its early stages? It means that we're beginning to have these kinds of conversations. We're not totally agreed yet on what the purpose or the vision is. So it's early stages. And I think as we have more conversations, as we have more seniors groups developing in different communities, because they are developing, we might see the movement get a little more mature. And as the movement matures, it then has more capacity to put the kind of political pressure on governments that you're talking about.
Mhm. Yeah,
Yeah, I agree 100%. But we won't be here for a long time.
Yeah,
That's another thing. We are passing on, bringing in the baby boomers and bringing in people other than that. That's where your education come into play.
Let's remember the baby boomers are behind us, and they're a huge cohort, and they've made a significant difference on lots of issues. And if we can immobilize them, they will on this issue too.
It's a good comment, John, to remember that social movements do take a bit of time, and to realize that when we're still trying to coalesce around the vision, it's hard to make headway unless you have that sort of coalition. So around that, Jerry, do you have another comment or question you'd like to bring
I do. I have a comment, I guess. One of the things I find extremely frustrating with provincial government in its attitude towards seniors and trying to change the whole vision is they really don't have to reinvent the wheel. There's so many models out there now. We've had, I think, successfully more in the West, but I think it was called the butterfly model that came in, I think, from England. There's a marvelous doctor down at Mount Sinai, whose name I'm going to forget, who's been to Europe, seen so many models of amazing home care services, keeping people out of long-term care, has tried to talk to Doug Ford about it. And Doug Ford's answer was, we'll do our own model. And that frustrates the hell out of me, because we could save a lot of time and energy because the models are out there. Doug Ford doesn't need to reinvent the wheel and bring up a new model. He just needs to be more open-minded and look around him and see what models are working quite successfully. It just boggles my mind that they are so misguided as to what seniors want. I'm hopeful of seniors going forward, because unlike our parents, where we had many stay-at-home mums, we've got a whole brigade of us now who are professionals, who retired from good careers and we won't take that kind of bullshit that comes from Doug Ford.
Jerry, I just make a comment to you because it's hard to understand the effect of all of these programs that we see, like the butterfly model, for example. I was on a Zoom call last year with the inventor of the butterfly model from England.
Right.
And he was quite open and honest when he said on this, he actually wrote me a letter afterwards, and he said that if I knew then what I know now, I would not have developed this model because it can't possibly make the changes that we want to see happen in the institutions that he was advocating for it to go in. The culture, the institutional culture, he said, was way too strong and would overcome the positive effects that he had hoped it would have. Are there minor changes? Yes, there are some changes, but not to the degree that we wanted. So it just means we have to be so careful and analytical about what we see out there critically analyzing things so that we don't end up on the wrong path once more because of good intentions and things like
But
that.
that's wonderful feedback. You learn from that, right? So I would look on him as a gem of information because he's a good example of what is working in certain instances and what is not. So you just don't repeat what's not working. So I still come back to the fact that it's not like we're asking the provincial government to build from the first building block up. We're not. There's good examples out there. Even if we just take the good bits from various models, I think we could get going a lot quicker than they have any intention of doing.
Doug, if I could just say briefly that I think where we're really talking about change here, we're talking about the need for three things to drive the change, right? We're talking about what do elders want and need. Let's really figure out how to listen to people.
Yeah.
As they talk about housing, as they talk about home care, as they talk about their loneliness, whatever it is. So what do elders want and need? Secondly, we need to base our work on good research.
Yeah.
There's a huge amount of research now.
Yeah.
That in all of those pillars that I named, there's extensive research in every one of them. So let's base it on good research. And thirdly, let's base it, what you're talking about, Jerry and Doug, is let's base it on best practice. Let's base it on what's working, but really critically analyze what's working to make sure that it fits with the research and fits with what seniors want.
Yeah, thanks, John.
That's great.
Let me just go to Elizabeth.
Hey, Doug.
Yeah, I just want to move on. We have some questions and our time's going to get limited. So I want to just move on if I can for a minute. Elizabeth, do you have a comment or a question you can bring forward? You're muted, Elizabeth.
Okay. I'm a baby boomer myself, and that's why perhaps we started this. And actually, so we met at JCC, I believe, a few times. And lucky me, because I wanted to do change, what we discussed was fabulous because the change needs to be done through changing the culture. What Jerry was talking about, Doug and John, it's a culture change. And this is what I try to mention, that I have a problem with this culture. Even I'm 35 years in Canada, work professionally with TCHC as accessibility manager, bringing universal standards to housing and new standards. And I'm working tirelessly with Rick Hansen Foundation. So everything, it's prepared and ready, and we are still having this big barrier with understanding and allowing us, doesn't matter how old we are, to experiment what John was saying. If we know that we would like to age better the way we like, give us a chance to experiment. This is what I'm asking. And I will be in Germany, by the way, Jay, next month in Munich. And, I know what you're talking about. We had in Toronto housing 78 buildings designated as seniors, which in them we brought many innovations, universal standards and stuff, only because the people who we were work with allowed us to do. My immediate boss didn't understand many things, but he at least didn't stop. So this was a big, fantastic, great thing. And then things went change because political games took over. So I think that something is broken because of the culture, not allowing us to bring innovation. This is my comment. Thank you.
Thanks, Elizabeth. Sue, do you have a comment or question to bring forward?
Yes, a few things. Just so many ideas swirling, but I feel that so much of this discussion is how do we move away from the institutional models? In the change we're looking for has to be multifaceted. It has to have the health supports, and that's not just home care, that's primary care. Like look at Jane Philpott's newest book on Health for All. We need primary care. We haven't got that. So we need health, we need housing, we need social supports, we need caregiving teams that are prepared, whether they're family or whether they're paid or whether they're community-based volunteers. And we need to use resources differently. Money, insurance, community resources, technology. So these are the 5 areas that I speak about in the Options Open Guide. And what I'm trying to do with that guidebook and the workshops is help people, all of us, as John says, start to build some consensus of understanding of the component pieces we need to move away from, and how we can innovate in these areas, these 5 areas, to move away from the institutionalized models. And I think that it is so entrenched, as everybody's saying, the institutional models, it's not going to work to change a butterfly model within a big institution. As Trish, I think, and I were nodding, like it's just, that's not going to work. I mean, we need person-centered care in the facilities that exist, yes, but where should our push and efforts lie in creativity? It's out in the community in these 5 areas. And so getting political folks to understand that and society to understand it is key, right? So that we have some work to do on just even speaking the same language and understanding these same concepts.
Well, Sue, as you say that, I'm thinking about the times that you and I worked together in the 1980s, 1990s. And at that time, there was an enormous amount of training. Call it training, but it's really education for people with disabilities, their families, caregivers. It was like those of us who understood the vision of building inclusive communities and person-centered and person-directed supports. We understood that a huge amount of education would be needed.
And the people leading a lot of that were also the people with the disabilities themselves, right?
Well, both. I mean,
I think of Ian Parker and Hazel Self and some of these wonderful.
Absolutely. Yep. As well as kind of inspired professionals. But
yes,
my point is we haven't reached that stage yet.
Yes, agreed.
In this beginning of the seniors movement, we don't have a lot of education. I mean, last weekend I was in Ottawa talking to a group for 2 hours, and it could have gone on for several hours.
Yes.
Because of the interest and the questions and the exploration and the wondering and the curiosity. And so that's just to put that out there, another possibility that we, as this movement builds, that more and more education needs to be part of it.
Totally agree.
Great, thank you. Joe, I see your hand is up. Do you have a question or comment for John?
I've got some questions and thoughts on what John has brought forward. I've been reading your book. I've got the final 2 chapters to finish, and it's very well done. Good work, and all the accolades to you and your leadership and vision.
Thank you.
Part and parcel of all of this is I see two aspects. In many ways, the carrot and there's also the stick. And John, and through the initiatives of this group, we're talking about the carrot and trying to build consensus and change the ecosystem of how we in our society address the needs of seniors and all those in needs, and providing a continuum of options so that we can optimize the health and well-being of all the members in the system. And that's not easy. Part and parcel of this, there are zones, I would say, where certain things can happen. And the difficulties come, and there's been no discussion about the transition between one stage and another. And this entails questions about risk management, which is key. We can talk about NORCs and how we mutually support the individuals support each other. And I think there might be come under the umbrella of Good Samaritans, but there's certain times where the members need to consider the health and well-being of the individual and the appropriate amount of risk. And that would be I'm wondering if there haven't been any difficulties in NORCs or mutually supportive communities where risk management has been a problem. So this is a key part of change and an appropriate vision. The other thing is the stick. And when we had the COVID, it exposed many discrepancies in the system and failures. And governments, they have laws, regulations on the books, and they don't see, I haven't seen anybody being hit with the stick. Even though Mr. Ford said, you know, when that report came out from the military about the horrendous situation in senior homes and long-term care homes, nobody's been hit with a stick. And as a point of reference, you may wish to think about this situation. Consider if this, instead of a long-term care home, it was a school, and this was happening to children. The police, the fire, the ambulance would have been there, and it would have been addressed. So this gets into the whole aspect of ageism, because nobody's been hit with the stick. And I know in many communities, and I live in Waterloo, we have a seniors abuse team that goes out and assesses risk and appropriateness, and they will lay charges if things are not adhered to. So the federal government makes laws and regulations, the provincial government makes laws and regulations, the community, the region, the cities have laws and regulations in the book. They need to be harmonized with the vision to make the carrot and the stick match, to point everyone in a just direction. So that's what I wanted to share with you. And John, if you have any knowledge where people say, you know, we can only go so far in this situation, and then it's time for a different team to take over. That was what I wanted to share. But
thanks, Joe. Thank you.
I mean, and Joe, in many ways, in terms of the stick, if you think of there being, you know, we can have thousands of people who have died. We had the highest death rate in the OECD in Ontario and Canada in nursing homes, and very little was done to give anybody the stick in terms of the effect of that treatment of people. So in that way, it was pretty horrendous. Yeah, for sure. Trish,
and sometimes for some
other hands up, Doug.
Sorry,
some other hands up.
Yeah, Trish has her hand up, and then Jerry. Trish, did you want to go, Trish?
You know me, Doug. I like to have the last word, but it looks like Jerry's going to have it.
Oh, no.
Jerry?
No, it's okay.
Go ahead.
It's okay. I'm fine with that.
No, go ahead. I can go ahead and you can.
No, that's quite all right. That's quite all right. No, just Joe, actually, contrary to the stick, Southbridge Corporation, where 78 people died in their Orchard Villa facility and where the military had to be called in, got a 30-year license and were allowed to expand to 15 stories on the same site. So that's what's been going on. The government has actually been rewarding those people. The other thing is, just quickly, I wanted to address something you said about risk management. As long as people are capable. See, what happens so often with older people is other people want to make their decisions for them. As long as older people are capable, they can take the risks that they want. There's something called the dignity of risk, which means that we are autonomous and we are self-determinate. And so if I want to decide to stay in my own home and only eat tea and toast for the rest of my life, as long as there's nothing wrong with me cognitively, I have a right to do that. And I think sometimes what happens is professionals forget that. So, we hear a lot about risk management, but families and friends who live in those buildings with older people, they usually know them very well. And quite often, what I've actually heard from people is that they stand up for their right to decide what they want to decide, as long as they don't have any kind of cognitive disability that's preventing them from making reasonable decisions. So we've actually supported that right to self-determination and said, you know what? If you don't want to go to a long-term care facility and you'd rather live on tea and toast, that's your absolute right, and we'll support that right. So basically, that's our approach to risk management at this point.
Well, I'm
Um,
really glad that Trish has given me the okay to live on cheese and toast because I love both. Thank you. And I was just going to say and follow up to Joe's comments about the stick, the actual same thing as Trish. I mean, the people that ran these appalling long-term care homes, they're getting their licenses renewed. There's been no stick. I mean, it's been a tragedy.
yeah, yeah. I know, John, you had mentioned you have some personal obligations tonight, and I want to we could keep you for a long time tonight. I'm not sure if you have a few more minutes
Yeah.
to talk about some of these things. But one of the things that it really intrigued me was when you said that you pushed a little bit in your personal life for family managed home care, and that you've got the ministry first, wasn't so supportive of it, but you pushed a little bit and pushed a little bit, and all of a sudden you've got some funding that's under your control that can provide the care in your place the way that your family needs it. And I know from my experience that family managed home care can be pushed. I'm aware of a situation where somebody was recently offered 12 hours a day for family managed home care. So the one thing we need to realize is that there is no limit on the caps for home care or family managed home care, and that people need to push a little bit like this. So I wonder, John, if you have anything to say about how it is that one can push the limits around things like family managed home care and other home care needs that people have to get more of what people need.
Well, I think, Doug, that kind of awareness is really important education, right? And people need to know there are no caps on home care. So when you're told you can only have 4 hours a week, you can make a case for why you need more hours. But I think the point here is to make the case. And oftentimes in the world of human services, we talk about having a good business case. Well, individuals also have to have a good business case. For example, oftentimes people are reluctant to have somebody come into their home that they don't know. And that was certainly the case in my family, that we wanted to have people coming into our home that we knew and who we could trust. And so family managed care, which is actually direct funding, where we get a budget and so many hours a week and so many hours a month, we have control over that. I think
How long has that been
part of it is
around,
having
John?
conversations part of it is having conversations with the people that you know in the system, right? And be willing to escalate your demands. In other words, you begin to have your conversation maybe with your care coordinator, and then you have the conversation next with perhaps the manager of that unit. So you carefully and slowly and respectfully, in a civil way, have those conversations with different people in the system. And when you've been doing this as long as Doug and I have, you get to know the people in the system fairly well.
Yeah, I think that's a very good, it's a very good understanding, John, that you put forward about you have to keep nudging the system, I think is what you're saying, and you're doing it on a personal basis, but you're also, that's also part of the system's change. If you keep pushing at things, all of a sudden, when you said there was now a family managed home care coordinator going in each of the regions, that's because demand is increasing, not because it's shrinking. So the more of us that understand this might be able to help, push the system beyond what is offered by the care coordinator who first walks in through your front door.
That's right, exactly.
Yeah.
And we have to think about two levels of that. There's the advocacy from the seniors groups, but then there's consumer demand. And as we move forward, both of those are going to influence change, and both of those are going to begin to shift priorities of government, which are already happening, right? Governments are aware of what we're talking about, and they're very much aware of the need for change and the shift to more resources for community and care. And so civil servants are often key players in the change episode because they give advice to their political masters, right? So maybe one or two of the political parties are supportive of our vision, which would be great. But in addition to that, you've got civil servants who are behind the scenes offering options to politicians, and that's very important stage of the process of change.
Yeah, absolutely. We had said that we'd come together for about an hour and a half today. We're at 8:30. So I think I wanted just to say, really thank you very much, John, for coming here and sharing what your research has been, what your understanding has been, how you've expressed it in your book. I would say to people, johnlord.net, you can go to that site and you can see John's publications and his book. And I think if you haven't got a copy of it, I think it's a good thing to get a copy of it and to keep the energy moving about the change that we want to see happen right now.
Well, thanks, Doug, for this conversation. I would welcome comments. If you go to my website, you can send me a note if you've read some essays in the book. I'd love to hear from you.
Doug, people can also send their comments to seniorsactionontario@gmail.com, and we will forward those to John.
Great.
That's on our website, first page.
Thanks, Trish.
Thank you.